Hi, I'm Kelly. I'm 50 years old from Oklahoma, and I am 1 month post-op from Dr. Nyack doing a deep plane facelift, neck lift, brow lift, the lower bleph, and the earlobe reduction.
Good morning. We are here the morning of surgery with Kelly. How are you?
I'm good.
Good. And Kelly, where are you from?
Oklahoma.
Oklahoma. Okay. And how old are you?
I'm 50 years old.
50 years old. Okay. So you're right in the sweet spot. Most of my facelift patients these days are mid 40s to 60. I think that's the 45 to 60 is the sweet spot that I see most of them in. I see people younger because I do have younger patients that have meaningful aging changes, and I have people that come in at 65 want a facelift. They have nothing to do. But you have some things I think we can improve. What do you see that you think we can improve?
Definitely the neck, and just the facelift and my eyes. I feel like they're kind of drooping, so I think the whole face we could improve.
Yeah. So what I see, face towards me, what I see, I agree.
Mhm.
There's room to improve the neck, and we can see the looseness in the superficial layers, the platysma, the skin, etc. We can kind of get a sense of this contour of gland prominence. Does that show, Joni? So you can get a sense of the contour of gland prominence. About a 16th of an inch, tip your chin down. You can see how the face has swung down here, and there's the jowl. Okay. So what I want to do is recreate the neck contour, and at the same time take this jowl, bring it back up where it belongs, and you can kind of see where this naturally goes. We're going to finish the job with the temple or the outside of the brow. That will also make obviously the eyes look better. Okay. Look straight into the camera. I'm also going to be working on her under eyes a little bit. We're going to use a laser for the superficial wrinkles. We're going to use some fat transfer to improve the skin quality. You can't see it, but I can feel it. There's a little sausage-shaped little lump right here that is either a permanent filler that she said you've had that dissolved.
Yes.
Yeah.
Yes.
So it's either a permanent filler like Artefill or Reddish or something like that that you actually can't dissolve, or it's a temporary filler that has gotten inflamed and created some scar tissue, and then the dissolving agents don't really work on that either. So if I'm able to get to it without creating any injury today, I'll take out as much of that as I can. If I'm not able to get to it without creating an injury today, I always like to point stuff like that out before the surgery so that people don't think it's a lump that was caused by the surgery. But hopefully it'll be the least of your worries. You'll just be enjoying everything else so much.
Yes.
And that's my impression of your personality. Yeah. What do you need them to know about the morning of surgery, or what your thoughts are before we go back there?
Really, I'm just excited.
Yeah.
I've been waiting for this, so I'm ready.
Good.
Yeah.
Okay. We're doing one other thing I forgot to say. We're taking your earlobes in, just a tiny notch, so that we don't have draggy earlobes on a sleek jawline. So that was the other little bit.
Yeah.
All right. Well, thank you for doing this.
Thank you.
You're welcome. Good morning. We are the first day after surgery with Kelly. We did for Kelly a deep neck lift, deep plane facelift, brow lift, so we did bunch up in the temple, lower lids. I did them a slightly different way. We'll talk about that a little bit. A little bit of lower lid laser resurfacing, and then we had some little surprises here and there. But first off, how was your night the first night?
Overall, the pain wasn't bad. I just didn't sleep very good.
Okay. What kept you from sleeping, do you feel like?
I don't really know. Yeah,
Yeah.
I would try to go to sleep, but I just couldn't stay asleep.
Most common complaint that we get is sleep is bad for the first few days after surgery. That's a number one. You would think it'd be pain. It's sleep. Speaking of pain, I know we asked you to take the Tylenol and the Celebrex just as the paving the road. That's the foundation. And then we give you a true pain pill, hydromorphone, which is allotted to use if needed for potholes. Did you take a pothole pill? Did you need it? Okay.
No.
So this is actually the most common scenario. They take our non-narcotic medications, Tylenol and Celebrex, and it's unusual that they take the true narcotic pill. So if you haven't taken that, you're probably not going to.
Yeah.
And what that means is during your anesthetic in the operating room and post-operatively, you have had a total of 0 milligrams of narcotic. We try to keep as close to opiate-free anesthesia and then post-operatively opiate-free analgesia as possible. I think you're going to be completely opiate-free.
Yeah,
which is good.
I think so too. Yeah, I think I need it.
And you ate a little bit today?
I did. I ate breakfast this morning.
Good.
Yeah.
Kelly presented some challenges. On yesterday's preoperative video, I showed you she had a little lump under her eye, and she had her injector try to dissolve that, and it really didn't go anywhere. When I saw her here in real life for the first time and felt it, it felt like either a lump of scar tissue or a lump of permanent filler. And as I said, if it was possible to get it without doing too much destruction, I was going to get it. I was able to get it. It was a lump of polymethyl methacrylate, so Artefill or Articol or Bellaffill, Metacryl, depends on which country you're in, what they call it. It's definitely that filler, and I can tell because when I go near it with the cautery, it smells like an electrical wire. As that filler kind of burns or melts, it's very acrid. It smells like wires, the casing on wires trying to burn. Anyway, got it out. You have these little stickers here. Were you expecting that?
No, I was not.
Yeah.
Yeah.
So I usually fill the depressions under the eyes with fat from somewhere else, but Kelli is in phenomenal shape. And I'm not saying phenomenal shape for a 50-year-old. She's in phenomenal shape. So there was nowhere that I could steal fat without robbing the skin quality. So instead I did a fat transposition with just taking the fat from the fat bags themselves, pulling it down into the emptiness. And so she's going to wear these little anchor stitches for a few days. The other surprise was you are a bleeder bruiser.
Yes, I am.
Yeah. So this is nothing she has control over. She's got a redder skin tone. People with redder skin tones have a richer capillary network. I expect them to ooze more and bruise more.
Okay.
Although you hardly bruised at all. You have some bruising in the whites of your eyes, but almost no bruising on your face.
Yeah.
And then she was really, really difficult to control blood pressure wise. She came in the morning mildly high, 130, no big deal. During surgery, she took 30 milligrams of labetalol, 20 something milligrams of hydralazine, and a continuous infusion of Precedex. So our anesthesia people will know what this means. To keep her just reasonable blood pressure wise. So she was a significant blood pressure challenge and an oozer. Between those two things, those are two of the biggest risk factors for bleeding after surgery, creating a emergency, a hematoma.
Yeah.
And when I'm in that situation, I used to stress out over it. Now it's irritating, but I don't stress anymore. Turn towards me, because we have this hemostatic net technique we can use. Everywhere that the skin was raised up, we have tacked the skin down to the foundation, right? And so if a little bit of bleeding picks up anywhere, it can't continue and travel across the whole face. It's trapped into one cell and it gets under pressure and it stops. The reason her front doesn't have any of these is because I transitioned to the deep plane at that point. And so all the rest of the front of the facial dissection was in the deep plane. Risk of hematoma is almost zero there. Do you feel them?
Just a little tightness
Yeah.
is what I feel, but
Yeah.
other than that, no.
Okay. So leave them in for 3 days. We will take them out and they'll leave no marks. It's remarkable. What else would you like them to know about your first evening?
Just hang in there. I mean, you're going to be exhausted and a little sore and swollen, but it's going to be worth it.
So she is post-op day 3, and we did a facelift, neck lift, brow lift, lower eyelids with a little fat transposition, earlobes, and you got the net.
Yes.
Okay, she just got the net out today.
Yes.
What did you think about that net?
I really didn't feel it, just a little tightness under my neck.
Yeah.
But other than that, it was fine.
Yeah, good.
Yeah.
It's like a safety net, we call it. How did that feel coming out today?
I didn't feel it at all.
Okay, good. Didn't hurt.
Mm-mm.
Okay, good.
Nope.
You can still see little marks where that net just came out, but that should start to subside over the next few days. So she just got it out. Might look like it's still there, but it is out. Well, good. So how was? I know your first night was a little rough with sleep.
It was. Yes.
Second night too.
Yeah, it was a little better the second night.
Okay,
Yeah.
So last night got a little sleep.
Yes.
Good.
Yes.
And you said today you're feeling kind of sleepy.
I am. Yes.
Okay.
Yeah.
Okay, good. That's pretty normal
Yeah.
after surgery as well. I mean, it's a big surgery. It's elective, but we still expect people to feel kind of tired and wore out from it. What are you thinking about going forward? Are you expecting more swelling maybe today, tomorrow?
Yes, I know that he told me the third and fourth day, so I'm expecting it. Yes.
Yeah. Are you using your ice and being good about
Yes.
that? Good.
Uh-huh.
Ice is helpful, and you're wearing a little compression device.
Yes. Uh-huh.
Perfect.
I've been using that.
Yeah. Do you like that?
I do.
Yeah.
Yes.
Patients tell me that it feels kind of comforting. We have like a strap that holds some ice there. So
Yeah,
we start that the first day after surgery. Okay, good.
Yeah.
And then you're going to do the hyperbaric chamber today.
Yes.
Okay, she's going to try that for the first time.
Yeah, I'm excited.
Good. Are there anything that's come along so far that was unexpected that you kind of wished you'd known ahead of time?
No, not really. I can't think of anything.
Okay. Is this been more painful for you than you thought it would be, or?
No, actually, less painful than I thought it would be. I've hardly had any pain at all.
Yeah, good.
Yeah, and you guys are awesome, and Dr. Knight.
Aw,
Yes,
thanks for
it's been
saying
the
that.
best. Yes.
Oh, that's what we have a good team.
Yes, you
It's
do.
me today because Dr. Nike is traveling, so we still see patients and keep him updated. We're in constant communication with him, so I know he'd rather be doing this with you than me. But anyway, you look fantastic.
Thank you.
So I'm gonna go ahead and have you turn towards me,
Okay.
and then we're just gonna kind of show what that profile looks like. Can you see that? I mean, nice shapes. You can still kind of see a little bit where the net was, but it's already fading actually, so that's very good. Okay, and then you can turn back towards the front. Any final words for day 3?
No, I'm just excited to see the end results.
Good. We're excited too. You already look fantastic.
Oh, my name is Kara, nurse practitioner with Dr. Nyack, and I am here with Kelly, and she is post-op day 7 after a deep facelift, deep neck lift, brow lift, lower blepharoplasty with laser treatment under the eyes, and earlobes.
Yes.
I think we got it all. Perfect. And how are you feeling?
I feel really good.
Good, good. So
I feel really good.
every day has been getting a little better?
Yes, yes. The swelling has been going down, I feel like, every day.
Yeah.
Still tightness under the neck.
Yeah.
A little swelling under the eyes, of course. But
Yeah.
other than that, I feel really good.
Yeah, and that's actually something that we hear quite a bit. A lot of people tell us about the tightness under the neck, but again, that's what gives you that beautiful jawline. So it's all
Yes.
worthwhile, isn't it? And
Yes,
in fact,
it
your
is.
jawline already looks really good. So every day does seem to get a little better. We do see that some of our patients kind of hit a little slump day at around post-op day 3. But we were just talking about this, and you really didn't have that slump day. You've kind of been increasing your activities every day as
Yes,
you
I
go
have.
along.
Yes.
Okay,
I felt
good.
really good.
I love it. Okay. And I know that you're in from out of town, originally from Oklahoma. She's here
Yes.
with her husband.
Yes.
And you did have the RN services your first night.
Yes.
And I hear they're wonderful.
They are. I would highly recommend them.
Yes,
Yes.
we appreciate them. We actually talk to them frequently, just checking on you. Dr. Nyack checks on you. I check on you. They have our personal cell numbers if they need anything, as far as any concerns, because they're constantly assessing you. They're cleaning your incisions. They make sure that your medicines are taken
Yes.
promptly on time, and just that person that can go and get something, comfort you.
Yes.
See, they've got little tricks that they can do just to make you more comfortable. And
Yes.
they're just so wonderful souls. So
They
we
are.
really do appreciate them.
Mhm.
So while you're in town with us, though, typically we do have people stay about 10 days with us in town, if you're from out of town. And through that 10 days after surgery, there are a few things that we typically do with our patients. The first thing, around post-op day 1 or post-op day 3, we do what's called a hyperbaric chamber therapy or treatment, and it's just for oxygenation or perfusion to those tissues for good wound healing. Now, I understand that you weren't able to do that. Is that correct?
I tried,
Well,
but yeah, I just couldn't do it. So.
yeah, and that's okay. Some people are claustrophobic or they have some ear issues, and if you can't do it, it's not a problem. It's one of those things that we offer, and if you can do it, great. But certainly, it's not worth having an unpleasant situation.
Yes.
So that's fine too. The other thing that we do offer is manual lymphatic therapy. So that is done over on our med spa side with the esthetician. So it is kind of a little bit more relaxing experience. And you had your first one today.
Yes, I did. Yes,
Fantastic.
I would highly recommend that.
Okay.
Yes.
I love it. I love hearing that too.
Yes.
So that is well-trained hands. Our estheticians have been trained in a manual lymphatic therapy, so they know how they can massage gently the tissues without disrupting Dr. Nyack's repair. And that's key. That's important because we really don't want patients or other people that don't know how to move the tissues or the swelling. We don't want any kind of manipulation or moving of those tissues because we certainly don't want a disruption of his repair. He's got things right where he wants them to be. So it's so nice to have experienced, well-trained estheticians doing those services for us. For any other service like dermaplaning or facial, Botox, filler, we typically say you want to wait until about 8 weeks or so afterwards. There's still so much healing and swelling and everything. You kind of want to just let that all come down a bit, recover a little bit before you start to do those services.
Okay.
Very good. Okay. Well, it's been lovely already taking care of you, and you're still
Thank
with
you.
us for another few days.
Yes, I am.
So it's raining today here in St. Louis, but hopefully you're able to get out. Have you been able to see a little bit of
Yes,
St.
we have.
Louis?
Yes, we
Okay.
have. Yeah,
Okay,
I
good.
really enjoyed it.
Okay, good. I'm glad. Well, thank you so much. I really appreciate you doing this video for everybody that's out there
Absolutely.
watching.
Yeah.
They really do appreciate it too, because it helps them make an informed decision on what's right for them, and it helps to hear your genuine story and journey with us.
Oh,
So
yes,
thank you.
absolutely.
Okay, thanks,
Thank you.
Kelly.
Thank you.
Hi, it's Kelly and Kelly.
Mhm.
We're here for Kelly's post-op day 10 visit today.
Yes.
So Dr. Nayak did a facelift, neck lift, brow lift, lower eyelids, laser under the eyelids, and your low earlobes.
Yes.
Did I miss anything?
I don't think so.
I think that's it. She's like,
That's
that's
it.
enough. She got the works.
Yeah.
So how you feeling on day 10?
I feel really good. I really do. My energy level feels good. I mean, I feel great.
Better than day 1 and 2, I'm sure.
Yes, absolutely. Yeah. Day one was a little rough.
Yeah, you can tell as the day goes on, the energies get better. So yeah,
Yes.
she's feeling good.
Yeah, I feel really good.
Wonderful. Was it an easy experience from beginning to end? You had some potholes in the road, or
Overall, yeah, it was a pretty easy experience.
Yeah.
I don't think I really had any issues. Towards the end, I was kind of getting a little lightheaded getting up and down out
Yeah.
of the bed. But other than that, I didn't have any issues.
good?
Yeah.
She's making it look easy. She's
Yeah.
not a complainer, and she's very compliant and a rule follower, which I love that. She did say today she had some tightness, still,
Yes,
and,
I still do. Yeah.
and numbness
Yes. Numbness right here.
out towards the incision lines and under
Yes,
here.
yeah.
Yeah, which is normal.
Yeah.
That'll last for a while.
Yeah.
It works out this direction. The numbness will, feel this, and then as you start getting out towards the ears, and then this way works out towards the incision line. So that's normal to where we expect her to be today.
Yeah.
And the tightness will linger for a while too, as she still has swelling,
Yeah.
of course. So
Yeah.
recognize yourself though.
Yes. Yeah. It's getting better. Yeah. It's getting better. I still see, I know it's still puffy under my eyes, of course, but I know it'll get better
Good.
each day.
Good. The positive attitude is a lot for this experience.
Yes.
If you come in and you're focusing on all the little swelling and the divots and the dents and it's easy to get yourself kind of down in a rut.
Mhm.
If you look at it positively, like I have to go through these downs to get up to where we
Yes.
want to be.
Mhm.
She's had that attitude. It's been fantastic. So we appreciate that. But everyone's different. Not everyone can see to the other side.
Yeah. Yeah.
So that's good that you can. Let's see. You've been doing some things here in St. Louis.
Yes.
Yeah, but she did say she was getting bored, ready to go home.
Yes. Yes. I'm ready to go home.
St. Louis is a fantastic city. There is a lot
It
to do
is,
here,
yes.
but 10 days here is a while. So make sure you bring some things to do as well,
Yes.
just in case you're,
Mhm.
here with your hubby or caregiver and they're bored too. So yeah, that's
Yeah.
fantastic. Well, good.
Yeah.
What else do you want people to know?
I've just had a great experience here. You guys have taken excellent care of me. Dr. Nayak, he is awesome. I would highly recommend you guys. That's all
Aw,
I can say.
That's sweet to say.
Yes.
Dr. Nayak is amazing, and thank you for
Yes.
coming so far, and you trust him.
Yes.
And the team, even though he's in Turkey, we've been communicating with him. As you
Mhm.
can tell, there's
Yes.
been no lack of
No.
communication. We know how to handle things if they come up, but he is our captain of this ship, so
Yes.
we do look to him to answer things that we don't know.
Yeah.
Let's see how she's looking. So face me, and then you can see her shapes are fantastic already, healing very well. Remember, she had all the full net sutures, so you can see that's almost not detectable at this point, and looks fantastic. It's even going to get better as
Mhm.
swelling resolves. So
I'm excited.
anyway, yeah, thank you.
Thank you.
Have a good, safe trip home.
Thank you. We will.
Hi, I'm Kelly. I'm 50 years old from Oklahoma, and I am 1 month post-op from Dr. Nayak doing a deep plane facelift, neck lift, brow lift, the lower bleph, and the earlobe reduction. And I just wanted to give you guys an update and let you know how I'm doing. I still have some swelling here in the cheek area and a little under my neck and under my eyes. I have numbness here by the ears, but other than that, I've been doing really well. I feel really great. My incisions are healing awesome, and I've really had no issues. I'm back to my normal activities, And I just wanted to make a short video for you guys and give you guys an update. And just let Dr. Nyack know that he is phenomenal. I am super excited to see the final result because I know it's going to be fantastic. And he is just the best there is. And I am so glad I chose him as my doctor. And I'm going to turn to the side now and let you guys see a side profile before I get off of here. That's the right side. And that's the left side. And hope you guys enjoyed this video. Thank you.
I hope you found this information helpful. If you did, hit that subscribe button and turn on the notification bell icon so you can see my future content.